The Degen Foundation, whose name honors Fort Smith historical figure Reverend Degen, invests in nonprofit organizations, medical institutes, and hardworking medical students to help the River Valley community take a step towards a brighter future.
Reverend Degen arrived in Fort Smith in January of 1866 after the Civil War. And so in addition to getting St. John's Episcopal Church open again, because the church had been closed during the Civil War, he was helping with schools, he was helping with roads and other civic type things in Fort Smith. A year and a half later, in July, there was a terrible accident down at the train yard by the river. A man by the name of Gerhardt had his foot crushed, and his friends took him to his boarding house and left him there. That was all they could think to do. And a couple days later, Reverend Degen showed up. Well, he was a minister, not a doctor, but he knew that Mr. Gerhardt needed some medical attention. He rounded up a Dr. Bailey, who said, "Yes, I will amputate this man's foot, but I'm not doing it in this boarding house. You have to find a decent place." So Reverend Degen, along with his wife Edith, went up and down Garrison Avenue to the various merchants and collected $500, which they paid to purchase a building at 4th and G Street in Fort Smith, which became St. John's Hospital, and it was the beginning of health care in the Indian Territory. Word got to Little Rock. A woman there decided to open a nursing school. A couple years later, Judge Parker was the chairman of the board of that hospital. So they invested the $500 out of kindness, out of duty, perhaps obligation, and certainly changed healthcare in our region.
My name is Melissa Sykes, and I'm the Executive Director of the Donald W. Reynolds Cancer Support House here in Fort Smith, Arkansas. For 12 years, since 2011, we have had a strong partnership with the Degen Foundation. They've been a champion to support the many programs that we have, that we provide free of charge to patients and their families in our community who are going through a journey with cancer.
We have a grant program at the Degen Foundation, which is designed to serve the people that are in need of improved health care in our region. Our region's defined as by 7 counties: Johnson, Franklin, Logan, Crawford, Sebastian in Arkansas, and LaFleur and Sequoia in Oklahoma. We call it the River Valley, and we design our program to serve the people in those areas. And the thing about that area is that it is the center point of the most underserved area in the United States of America. The needs are greater here than virtually anywhere else in the country. Since 2012, we've given out in grants about $1,900,000 to the local area to improve the health care for those most in need. In the community, our first grant is worth noting, I think. It was a little over $100,000 grant to the EMS of Fort Smith. The EMS requested it so that they could provide doctor care while they're transporting patients who they picked up. So the ambulance itself will be in communication with a doctor at the hospital. So care can be started immediately upon that, and that was cutting edge stuff, and we were very excited to be a part of that.
They care about community and about serving and helping others. With their funding assistance, they've enabled us to help the intellectually and developmentally disabled patients in our community. It's because of their funding that we've been able to continue our programs here. Speech language therapy, aquatic therapy, physical therapy, and occupational therapy. Literally every aspect of the Kistler Center they have helped fund, including autism waiver and CES community waiver.
My position here at the Gregory Kistler Center is the role of the Executive Director. I cannot think of a more wonderful organization other than the Degen Foundation, who's helped so many healthcare providers in our community. Those contributions have enabled our therapy departments to use equipment that we've never had before to provide the care for the children in our community. They've provided software and even communication devices for our waiver programs in the community. They've assisted with our aquatic therapy and providing supplies that's needed in that arena also.
The scholarship program was started initially to recruit nurses. We had such a shortage of nurses when we started in 2010. So now, once a student has been accepted to the medical program of their choice and they meet the qualifications that we require, we can help them with their education to get a degree in either nursing or radiography, dental hygiene. We have several students that have applied. We have over 140. I would say at least 75% of those students remain in the area, which was our goal, was to have them come and stay in the area. Please visit the DegenFoundation.org website for more information, where you can apply for grants, you can apply for scholarships, and you can read all about the ways that we've been able to help our community, as well as our supported organization, the Arkansas Colleges of Health Education.